To date, there are 2 oral JAK inhibitors that are approved for this indication of myelofibrosis. There are no therapies approved beyond failure of JAK inhibition, and even JAK inhibitors are restricted to patients with preserved blood counts and thrombocytopenia. There has been a lot of progress in clinical trials targeting therapy beyond JAK inhibition, either in a combination as first-line therapy or in combination as an add-on therapy, such as our protocol. And also a third arm is in patients who have completely progressed beyond JAK inhibition and JAK inhibitors have failed them and they will require more novel therapy. There has been progress in all of these agents, all these directions. So there are multiple clinical trials that are now designed in first-line setting with combination of ruxolitinib for all patients, all comers, including patients with, including agents with BCL-X inhibition and patients with BET inhibition and other novel therapy, and including interferons. Add-on clinical trials have also incorporated agents that might have additional benefit without additional toxicities, such as our study, as well as other drugs with other classes, and there has been very promising results presented recently. Beyond JAK inhibition, there has been many brilliant work by many groups of the agents that are very promising are LSD1 inhibitors. These have been presented in prior meetings, including EHA this year, as well as in ASCO and ASH of last year, showing promising results with patients beyond JAK inhibition with LSD inhibitors. There are also other novel agents, including targeted agents to CD123 that have been with proof of concept positive data, and we look forward to hearing more about these agents. Bone marrow transplantation remains the only curative therapy. There had been controlled registries for allogeneic stem cell transplant, as well a lot of implementation of this methodology, and now we're also comparing that to standard of care therapy to find out which patients would benefit best with an early approach for allogeneic stem cell transplantation.